Hello, everybody. Thanks for joining us today. This is a 2-hour webinar on grief and loss in foster care and adoption. And this training is being brought to you by the Central Missouri Foster Care and Adoption Association. My name is Denise Rice. I am a social worker and a therapist currently in Colorado Springs, Colorado. And I was asked by the Central Missouri Foster Care and Adoption Association to put on a 2-hour webinar on this topic for families in Missouri, and was beyond thrilled to be asked to do so. So just a little bit of background on myself, just so you guys know where I'm coming from. I am a licensed clinical social worker. I'm also a licensed addiction counselor here in the state of Colorado. I've been in social work for just about 20 years. Most of that career has been focused in foster care, kinship, and adoption. I also have a pretty significant background in mental health as it relates to child welfare, and also have some specialty experience working in adoption, as well as for the last 5.5 years have been working in a hospital emergency room here in Colorado Springs doing psychiatric and crisis evaluations on patients who come into our emergency department, patients who are suicidal, homicidal, gravely disabled, under the influence of drugs and alcohol. So again, been doing that for about the last 5.5 years. I also own my own training and consulting business. It's Hopeful Healing Training and Consulting. And I am very privileged to be able to travel all over the country to present to a variety of states and agencies on topics related to foster care, kinship, adoption, trauma, how trauma affects the brain and development, how that translates into dealing with oftentimes difficult behaviors, a lot on secondary trauma, self-care, as well as a variety of other topics. My email is up on the screen. If you have any additional questions or want any additional information or resources after this particular webinar, please do not hesitate to contact me. I am happy to provide that information to you. So again, this is a 2-hour webinar. We're going to be looking at grief and loss in foster care and adoption. We're going to be looking at how it impacts caregivers, as well as how it affects our children and our youth, and how really we can all work together to kind of create a safe place in order to, number one, acknowledge that there really can't be foster care or adoption without grief and loss, and how we can effectively support one another throughout that journey. So that's what we're going to be looking at today. So again, here is kind of the agenda for the next couple hours. Going to kind of introduce grief and loss for all parties involved in foster care and adoption. We're going to look at the stages of grief, the manifestation of grief in both children, youth, and caregivers, and some of the differences. Look at some ways to facilitate the grief process. This could be for yourself if you are a parent, and how to support others, particularly maybe the children or the youth in your home. Particularly what caregivers and parents can do to help, and then what can happen if we do not grieve. The other thing I'm also happy to do is, if you would like a copy of this PowerPoint, I am happy to email that out as well. I will email this to the staff at the Central Missouri Foster Care and Adoption Association so that they have it if you're more comfortable contacting them, or if you want to contact me directly. Again, I'm happy to email this out to you in its entirety. And I have different resources, videos, and things kind of embedded in the PowerPoints, as well as a resource slide at the end that has some additional books and websites and places that you can go for additional information. But the first video, I just want to point out, most of my videos are from YouTube, so you can just go online, go to YouTube. This is put out by British Columbia Foster Basics. They actually have a great series of videos and short little webinars for foster parents. They have, this one is on grief and loss, and this is the link. So if you go to YouTube and you type in BC Foster Basics, grief and loss, this video will pull up for you. So if you get some time, I'd encourage you to take a look at that. All right, so the next slide is kind of looking at loss and managing loss. And grief is a result of some loss. Grief is the process of recovering, or our attempts to recover from that particular loss. You know, adoption and foster care create a situation in which an adult or a child experiences loss and then subsequent grief. And for those of you who might be adoptive parents, we really cannot have an adoption without significant loss. They really go hand in hand. And it's easy for us to forget that. You know, there would not be adoption without loss. Somebody had to lose in order to get to an adoption, to get to that happy place. And it is easy to overlook at times, but it is still a part of that story. It is a part of that experience that has to be acknowledged, and it has to be honored. You know, I often reflect back to a quote by Dr. Dan Siegel in a video that I use in a lot of my trainings, where he says, you know, what's shareable is bearable. You know, when something is unmentionable, it's unmanageable. But when we can share it, then we can deal with it. And I know there are a lot of folks out there that are very apprehensive about having certain conversations with their children, maybe about adoption, maybe about being adopted, maybe about or related to their birth family. And I just want to leave you, you know, again with this, what's shareable is bearable. What we don't want to have happen is creating topics, conversations that are, you know, embedded in guilt and shame. And for our children who have come to us, you know, maybe through foster care adoption, maybe international adoption, if that applies for you, their story is a part of who they are. And we don't want any part of the pieces to the puzzle for our children to be embedded in shame and guilt, or feeling like something is wrong with them because we weren't comfortable talking about it, or we kept information from them for whatever reason. So just something to think about. There's a couple of other clips on here, just another resource for you if you're not familiar. Dr. John DeGarmo, he also has a number of videos on YouTube. Some of them are through a collection called Foster Care 101. He has a couple on grief and loss that I've listed here on this slide. And he also has a 20-minute online webinar on grief and loss, and I've attached the link to the end of the PowerPoint presentation, so that if you're interested and would like to take a view or listen to that one as well, you have that information. All right. So I kept this slide in here because depending on what format you're, you know, listening to or watching this webinar, I always try to find opportunities where folks can kind of pair up with each other and share some information about, you know, what brought you to this particular training, you know, what are you struggling with, what, you know, would be the most helpful for you, what are you looking to get out of it. So if you're watching this maybe by yourself, or if your partner's with you, or if you're kind of in a group setting, just take a minute to kind of look at some of these questions and think about it, and maybe jot down some notes. either by yourself or if you're with somebody else, share what you've lost while being connected to foster care and or adoption. What are all of the things that you have lost? What has changed? Maybe not lost, but what has changed? And have those changes created any source of kind of loss? And have you noticed you've kind of grieved some of those losses at all? How have you acknowledged and processed these losses? Did you even really know that they were losses, or the severity of these changes that have happened in your life and in your world? The other thing I'd ask you to think about is, as a child growing up in your family of origin, how was grief and loss talked about in your home? How did it play out? What did it look like when there was maybe a death in the family, or a pet that died, or you moved from your hometown that you lived in for a long time to somewhere else? Those types of events, how was that handled in your family of origin? How did your parents, your caregivers, process grief and loss? Was there crying? Did you talk about it? Did you kind of have your own type of ceremonies? What type of ways did you commemorate those changes, those losses, if it was a certain person or an event? And how has that continued into your adult life? How do you grieve losses now as an adult? Is it the same way as it was before? Or did you realize that that wasn't really helpful for you, how it was handled in your family of origin, so now you want to do it differently? Maybe you grew up in a household where crying is a sign of weakness, and when things get bad and things get rough, you just, you don't show any emotions. You just pick yourself up by your bootstraps and you just keep going. You just forge ahead, and you don't really acknowledge anything. You don't talk about it. You don't share anything about it. It's kind of like almost it didn't exist. And then how was that helpful or not helpful for you growing up? Some of you might have grown up in households where it was the complete opposite, where it was embraced and it was supported that we talk about these things and that it's okay to show emotions. We all have feelings and we all have to do something with those feelings. And were you in a home that was that safe space for you, that you could share those experiences? Think about that, and then think about how is that translated into your adult life, and how do you deal with grief and loss now as an adult? Because that's really going to be pivotal when you have children and youth in your household who've experienced insurmountable grief and loss and are really depending on their caregivers, their parents, to help them navigate those waters. And so, again, I'm going to go back to what's shareable is bearable. And we don't want any of us to be kind of carrying these big, heavy weights around. It takes a toll. It takes a toll on you, physically. It takes a toll on your mental well-being. It takes a toll just kind of overall. It will have an impact on you and how you function. So think about that for a minute too. And how would you describe your grief process? And I know that it varies person by person and it varies situation by situation, but is there, a particular pattern that you notice about yourself? And what do you feel like you need to help children and youth in your care be able to grieve in a healthy way, be able to grieve openly and honestly, and grieve in a way that they're not going to hold back because they're not quite sure if you can handle their pain and that you can handle their loss and that you can handle those big feelings that a lot of our kids have. So, again, I just kind of encourage you to think about that for a few minutes, kind of as we move into this presentation. All right. So again, all children in adopted and foster families have experienced loss. And if, we were again face to face, I'd have a big, on a whiteboard or on a flip chart piece of paper, we'd be going through talking about, so let's name all the losses. And we would kind of do a comparison. We would have a list for the children. What are all of the things, not just tangible things, but what are all of the pieces in their life that they have lost? And we would write a big long list. And, again, if we wanted to come up with a list, we could come up with things like, they lost their parents, they maybe lost their siblings, they lost their belongings, they lost their favorite blanket, they lost their, friends, their neighborhood, they lost their normal, they lost their abuse and their neglect. Even though that's a positive, it's still a loss. That was all they knew prior to the life they have now. They lost their culture, maybe lost some of their traditions, lost maybe some information about their family, maybe lost contact with extended family. The list goes on and on and on and on and on. So then if we were doing a list of what have our, caregivers lost in this process, you guys can all chime in on what are the things that you have lost in this process. Some people say privacy, some people say flexibility. I've lost the ability to be spontaneous, to just go when I want to. I've lost the ability to maybe work. I've lost the ability to just kind of make some impulsive decisions. I've lost maybe, time with my partner, time with my other children. You guys know, if you think about all of the different things that you have lost in this process, and kind of hold on to that for a minute, because we're talking about all the things that you have lost, as well as bringing children into your home who have lost a significant amount as well, and putting you guys together and expecting you to figure that out. And it's interesting that, the quote on this slide, adoption loss is the only trauma in the world where the victims are expected by the whole of society to be grateful. So that's not to negate that it is not an exciting, happy, a joyous, momentous occasion. But again, going back to, it is created because of significant loss, human loss, loss of a parent, loss of maybe, two parents, loss of extended family in some cases, loss of siblings, loss of connection to that whole identity in a way. And yet we're supposed to just always be very excited about it. But there's a whole nother side to it that we need to acknowledge and that we need to kind of pay tribute to. So again, that is kind of the purpose of why we are even having this conversation. So it's important that we kind of have a foundation, kind of a baseline of kind of what we're talking about. So I went ahead and put in just, these are by no means the only definitions for these different experiences, but looking at loss is being defined as the disappearance of something that might be cherished, such as a person, a possession, or a pet. And then grief is the normal multifaceted response to a loss. This can include emotional, cognitive, physical, behavioral, and social components. Bereavement is the process of adjusting to a particular loss. And then mourning is defined as the culturally structured response to grief. And that, of course, varies, culture by culture, sometimes even family by family, how we mourn grief in relation to a loss. So again, just some slight variations on some of these definitions. Again, bereavement, the state of having experienced a loss. Grief, is the generally passive and involuntary reaction to the state of bereavement. Mourning, the active process of coping with bereavement and grief. And then the natology is the study of death and dying, in case anybody was interested in that. Okay, so I know this slide is a little bit blurry, so my apologies on that, but kind of looking again at grief, bereavement, and mourning. One thing that's important, I know that there's a little bit of repetition in these slides, but one way, actually the only way that our brain learns information is through repetition. And when we have repetitive kind of patterned experiences, the neuronal pathways in our brain actually strengthen tighter. And so the more we hear something, the more it sticks with us, the more we're able to recall, the more we're able to kind of hold that piece of information. So I know that this is a little bit of repetition, but there is kind of a method to my madness with that. So I hope that makes sense. And that's also why for a lot of you out there who are parents, sometimes I know that you get really frustrated when you have to be a broken record with your children and your teenagers even. And what I want to say to you is this is a whole nother training, but again, the brain only learns through repetition. And so especially when you're dealing with brains that have been impacted and insulted by trauma, whether it started in utero or the first, however many years of life before they came to you, their brains and their neuronal pathways have been hardwired a specific way. And so when you are trying to kind of reteach and relearn, you have to experience those new endeavors repeatedly again and again and again and again and again, so that the neurons in your brain can actually make these new connections and can actually strengthen. And so that's why you feel like a broken record. And I know that it's exhausting, but you're going to have to be a broken record because our kids' brains are hardwired differently than maybe your biological children's brains who didn't have that insult and that injury because of trauma, again, going back in utero for the first however many years of life. So I just want to say to you that I know that it's exhausting, but it's a necessary part of rewiring the brain so that our children and our teens especially will have these new, more positive, appropriate behaviors and interactions. So it's a part of the process. And so again, in training, you're now a student and you're having to listen, and it's very difficult to retain information. You're only going to remember a small percentage of everything that I talk about, but the pieces that I can get some repetition in, those pieces might be a little bit stronger than everything else. So I hope that makes sense. But again, another kind of description of grief, the normal, dynamic, unique, and multidimensional set of feelings and thoughts and related reactions of an individual following an actual or perceived loss. For example, the death of an emotionally important person, a loved one, a non-death related loss of someone or something of value, significance. So grief is both a normal and an adaptive process. Grief is both a normal and an adaptive process. Normal because it's a reaction that helps a child or adolescent confront a particular loss, and you can put an adult in there as well. And it's adaptive, although it's painful to go through, it can be productive in that an individual can learn through that particular experience. And so again, I kind of go back to, there's a kind of the Chinese definition of crisis is opportunity, and that within every crisis, there's an opportunity. So again, I think, again, we are going to have experiences of loss and grief and bereavement and mourning as a human being. I don't think you can live your life without experiencing those. And then it's, what do we do with that? How do we move through that process, allow ourselves to move through that process, utilize the support and resources of others around us. And then, from the adaptive standpoint, learning something about ourselves maybe through that experience, or maybe what we can do differently next time that would help us. Okay. So there is also this thing of complicated and uncomplicated grief. And complicated grief, let me go back, sorry, my apologies. Uncomplicated grief is kind of the natural progression of grief after a significant loss. Typically, a lot of our, symptoms will resolve themselves, within about a few months and not really impact our ability to function on a day-to-day basis. So that's kind of uncomplicated grief, is kind of that typical, I don't want to say typical because nobody is really typical, but the reactions, the responses that we have to a loss, kind of moving through our own grief process, whatever that looks like, in a way that doesn't last longer than maybe typically 6 months or a year, and it doesn't really impact our ability to function in other areas of our life. Now, grief and loss never fully go away. They somewhat will resolve themselves, and that we're able to kind of move forward in our lives. But then when people kind of get stuck and kind of don't move through that grief process, whatever it looks like individually, we kind of move into this thing called complicated grief, where there's really kind of a lack of improvement over, excuse me, a period of time, typically longer than 6 months. And there is an impact on the ability to function and perform daily activities. So some of the symptoms of complicated grief that may be present, maybe 6 months to a year after the particular loss, are listed, on this slide. Persistent and invasive thoughts of your loss that disrupts daily activities, avoiding or feeling consumed by reminders or memories of your loved one, unable to accept the finality if it was a death, intense yearning for your lost loved one, feeling angry about the death, feeling numb or confused, developing a loss of trust in others, isolating from others, suffering physical symptoms similar to that experienced in maybe the deceased's final illness, if that's what it was related to, feeling that life is meaningless and hopeless without that particular person in your life. All right, so something else to kind of pay attention to with complicated grief is that, again, if it starts to impact an individual's ability to function on a day-to-day basis, then we need to take a look at that. Might require some more intense interventions, possibly some counseling or therapy, some sort of an outside referral. Looking at denial, looking at, is the individual having like post-traumatic type of reactions? Is there an increase in intrusive thoughts? Is there, are they avoiding more than they did prior to this particular loss? Is there kind of heightened arousal present, their reactions to certain things? Looking at their functional decline, looking at the intensity and the duration of the grief and how it's impacting overall functioning. And then the type of loss, so all of these factors kind of combine again, but when somebody is impacted in a way that they are not able to perform or function day to day, their normal activities, going to work, taking care of, they have children, excuse me, self-care, hygiene, things like that, then it might require some outside assistance. And there is a handout that I found that looks at complicated versus uncomplicated grief, and I've put the link up here for you. It's just a one-page kind of comparison side by side, which might be a useful tool for you, or maybe to share with somebody that you know who might be struggling, with a particular type of loss. Okay. So there's a variety of different types of losses. some of the research that I've done when I'm looking at kind of creating a couple different trainings regarding grief and loss is there's really kind of two main types, excuse me. The first type of loss is maturational. Excuse me, I'm going to get a drink real quick. All right, my apologies. I've been struggling with a head cold and a very bad cough for the last week. So maturational losses are experienced by all of us through the course of human development. These are losses that happen as we move through different developmental stages. So moving from childhood dependence to adult independence, that is a loss. It's a loss of what was, moving into a loss of what is now, kind of that loss of different types of identities and roles, taking on more responsibility. And then also rites of passage are also considered maturational losses. When you get married, there's a death, you have a child. It's kind of, again, natural experiences that happen through the course of a human being's life. And then there's situational losses. These come from a normal experience and can interrupt human development. These could be things like a move. It could be a move even, within the same state. That can be a loss from what we knew, a loss to now our new normal, whatever that looks like. Changing jobs can be very stressful. That can be a loss for folks. Abuse and neglect and resulting separation from birth families. That's a loss. It's a loss for our children and our youth who have come into the system. Divorce, again, it happens. It is situationally based. It doesn't happen to everybody. It happens to a lot more folks now than it did, 30 years ago, that we are impacted by divorce. And that creates change. And sometimes with change, that creates loss. Most human beings are very uncomfortable with change. We like kind of the status quo. Change and loss can create and elicit a lot of sense of anxiety, kind of not knowing what's going to happen, not knowing what's coming. But again, it is a part of the human experience. So managing the two types of loss and resulting grief. From the maturational loss standpoint, role models influence how we manage and resolve this grief. So this kind of goes back to when I asked you earlier, when you were growing up in your family of origin, how was loss handled? Was grief was that a word that even came up in your household? Your parents, your family members, those are who you depended on to help you figure out what to do with these changes. Our role models, our parents, our family members influenced how we managed and resolved. We only knew what we knew, and we only knew how to deal with this based on the people that were closest to us. And so we modeled how maybe our parents and our caregivers handled loss. Situational losses, there's a lot of different factors that can influence the management of this particular type of loss. Sometimes these types of losses can be more difficult to resolve and work through. Parenting attitudes, parenting style, support system, the child's innate temperament and personality, child's understanding and perception of the event can also play a part into this as well. All right. So situational losses experienced by foster and adoptive children. Again, this isn't kind of an end-all be-all list, but just some things. The loss of the relationship, usually people and animals, loss of objects that give them comfort, loss of the familiar environment, loss of self, identity, loss of familiar habits, routines, traditions. And then I'm sure you can think of other losses as well. So were any of these some of the losses that you all came up with when I asked you in the beginning to think about kind of what's changed for you as a foster or adoptive parent? What are some of the common kinds of losses that caregivers have experienced? Maybe you've had work changes. Maybe you had to go to part-time, or maybe you were not able to work at all because of the needs of your child. Schedule flexibility. Just kind of be able to maybe decide things kind of on a whim. Now, maybe you have a lot of different appointments and have people coming to your home quite a bit. Loss of privacy. That again kind of plays into, there's a lot of people that want to come into your home and talk to your kids and talk to you. And that can be, I mean, that's a change. That can be a loss of, having your own space if that was something that was important for you. Work changes, again, related to role changes. Maybe had to change professions, maybe change careers, marriages, divorces, deaths, separations, any reunification that has happened. If you've been a foster parent, you've had children placed in your home and they've maybe gone back home or have had to be moved to other placements, adoption. And then youth transitions, like moving into independent living. So maybe your kids go to college, or maybe they move into their own apartment and are working. That's still a loss. Moving, we talked about. Maybe you've had changes in your friends, your social support, maybe your support network. And then what are some other things that have come up for you? And who's really affected by all of these losses, whether it's for you as a parent or for your kids? Kin providers are also affected by these losses. Children in the home, maybe your biological children in the home, extended family are also impacted by these changes as well. Okay, so the next little section I kind of want to talk about is ambiguous versus kind of traditional loss. Traditional loss, we have typically some warning after if it's related to a death, and in most of the research on grief and loss, it's related to death. But we know, of course, in our population that that is not the only experience that constitutes grief and loss. So for traditional loss, again, kind of mourning the loss after death, there's customary rituals that allow for closure, some tolerance to the loss that results from a death. And the loss as a result of a death is legitimized by society. But when there's an ambiguous loss, and again, ambiguous meaning kind of unknown, unclear, you cannot really mourn because there's no defined death to particularly mourn. So when you think about ambiguous loss, I think about for our kids in the system, or maybe for children that you've adopted, is if their parents have disappeared. And we don't know if they just moved to another state. We don't know if they passed away. I mean, there's just this unknown. We don't know. And it makes it very difficult to mourn when you don't know exactly what has happened. And so for ambiguous loss, again, it makes it difficult to kind of mourn because we're not quite sure what exactly are we mourning. Some of the typical rituals that ordinarily support a loss don't necessarily exist for an ambiguous loss. Others in society are less likely to tolerate this ambiguity. It's not clear-cut, it's not defined. Makes it very difficult for people to wrap their head around. And ambiguous loss is not typically legitimized by most of society. There's not as much understanding, I don't think, when it comes to just kind of this not knowing piece versus when you have the answers. And ambiguous loss is really the type of loss that a lot of our kids are struggling with. And for some of you that have been in foster care, and again, you may be also adoptive parents as well, but if you've been in foster care and you've had children placed with you and they've been reunified, you probably didn't have, in some cases, didn't have any further contact with those kids and maybe never knew what happened to them, never knew where they went. That's an ambiguous loss. That's a loss that it makes it really difficult to kind of wrap your brain around because there's no finite ending. Like, you wish and you hope for the best, but you don't know what happened. I mean, and in a lot of cases, a lot of our foster families, when the children are reunified, you know, unless there's a strong connection or relationship with the biological family and the biological family wants to maintain contact, you don't know what happened to those children unless you get a call that they're, you know, have come back into care down the road. But that ambiguity is very difficult to handle. It's very difficult to kind of move through kind of that mourning, that bereavement process when there is this huge unknown that's kind of weighing on you. So ambiguous loss affects our caregivers, and it also affects our children, especially, you know, with regards to not knowing maybe where siblings are, not knowing where parents are or extended family members are. Okay, so looking at some of the types of ambiguous loss, you can have a physically absent, psychologically present type of loss, or you can have a psychologically absent, physically present type of loss. So let's go through these. So physically absent, psychologically present, these can be things like adoption, missing people, not knowing, there's no verification of death, there's no certainty that the person will come back, they're just missing. Miscarriage, stillborn delivery, natural disaster, and catastrophic tragedy can also be categorized as an ambiguous loss. The psychologically absent but physically present, these could be with parents who struggled with addiction. This is seen in folks with dementia and Alzheimer's, individuals who may struggle with mental health issues, maybe when there's a separation or a divorce, a person who has suffered a traumatic brain injury, some serious kind of medical illness, that would be categorized as psychologically absent but physically present. So physically bodies are present. The reason migration is under physically absent, psychologically present, is that sometimes parents are separated from their children. They're physically not in the same space, but they're psychologically present because they maybe have moved somewhere else to try to obtain employment so that they can send money back home. So they're, again, not physically there, but psychologically the love and the connection is still there, but that parent is not there in order to provide for their family. Okay, so just kind of a recap on ambiguous loss. You know, again, we look at things like traumatic losses. These can be externally caused. Sometimes there's just an unclear loss. It might feel like a senseless loss, a lack of closure, understanding. We a lot of times can then get frozen in our grief, can be stuck in limbo. And then it becomes really a unique individual journey on what to do with that, what to do, how to process, how to integrate that particular loss into one's life. Okay, So just to kind of share some of the elements that influence a foster or adopted child's experience of loss is first and foremost kind of the reason for a particular move. You know, why was the child removed from the home or placed for adoption? Was it because of abuse, neglect, drug or alcohol use, domestic violence, combination of all the above? You know, what was the reason for it? The age, and it's not the chronological age, but it's the developmental and the emotional age. A lot of our children who have experienced trauma are delayed. You know, when you look at kind of those typical developmental stages and you look at those chronological ages that are tied to those developmental stages, a lot of our kids are behind because they weren't getting what they needed in order to progress, in order to grow, in order to develop, in order to walk, in order to form language. But really kind of where was this child at developmentally and emotionally when the loss happened? Kind of what is the timeline of the particular move? You know, did this particular placement happen after many visits or was it very quick and very sudden? You know, the trauma of moving into a foster or adoptive home after being removed from the birth home by the police is going to have more an effect on the child than the planned move from a foster home into an adoptive home. And what was the level of support? The support and understanding given to the child, an understanding caregiver, foster adoptive parent who's open to talking about the child's losses and listening to the child's feelings will help the overall grieving process. And this is really good practice for us as caregivers for when we are put in the position of having experienced loss and then dealing with the grief because of that particular loss. And, you know, we all know if you've been in foster care and adoption for a while that, you know, you're going to experience loss. You are going to be compounded with grief. You are going to mourn. You are going to, I think, need these opportunities where you have been able to provide this level of support for your children so that you will be a little bit better prepared for when this happens to you. But our children and our youth in the system are dependent on us. And even those that have been adopted, they're dependent on us to provide that safe space for them to be able to kind of dump sometimes and be able to kind of vomit. You know, it's an expression, but all this uncertainty and all these emotions that they're carrying around with them, huge, big, heavy emotions that they're carrying around with them, we have to put ourselves in a position where we can come alongside them and that we can say to them, you know what, I can handle this with you. And when you say, I'm here for you, you need to be able to handle their stuff too. And that stuff includes some really deep, dark, heavy emotions that our kids are carrying, especially around grief and loss issues. So first and foremost, friends, I really want to encourage you to kind of do some of your own work. And maybe just kind of talking about this subject matter is bringing up some stuff for you. And if it is, that's okay. Don't try to stuff it down, but honor it for what it is. And maybe you need to kind of seek out some extra assistance. You know, you might need to talk to a therapist or a counselor, and there's nothing wrong with that. You might need to reconnect with your support group. You might need to, you know, kind of tap into some of those, you know, those connections, those relationships that have helped you before, and that's okay. You know, even if, you know, you thought, gosh, I worked on this stuff years ago, you did, but maybe now it's just coming up again. And like I said, a lot of these experiences never fully go away. You know, they're lifelong. So it's okay that we need to kind of go back and we need to kind of get a tune-up, if you will, so that we can be the best parents, caregivers, and providers for our children and our youth who are depending on us to be able to kind of handle their stuff. And who can say to them, you know, I'm serious when I say, you know what, whatever you need to talk about, you know, we can handle it together. So, you know, walk that walk. Take care of yourself first so that you can take care of them and that you can provide what they need. Because they deserve it. They absolutely deserve it, and we have to get that for them. So the next section that I'm going to talk about is kind of moving into the traditional stages of grief and loss. And what I want to say about this, just a little bit of background. So these are kind of the traditional adult stages of grief and loss as described and defined by Elizabeth Kubler-Ross. Just so you guys know, so this original study was actually done on adults in the end stages of their life. So these were adults that knew that they were going to die. And Elizabeth Kubler-Ross, over the course of some time, kind of gathered, you know, interviews and touched base with these clients on a regular basis to kind of see how they were moving through this process, knowing that they were going to die. So again, this original research was done on adults at the end stages of their life. This model has been applied to all ages with regards to grief and loss. One thing that I have learned over the course of my career is that, number one, how we handle grief is very individual. Two, there really isn't a specific timeline in order to kind of resolve kind of moving through grief and loss. And when we're talking about children and adolescents particularly, they don't move in a very linear process when it comes to grief and loss. They really kind of bounce all over the place. And it's kind of like a big circle, and you kind of, if you were to draw a line, you know, going from one side of the circle to the other, that's really how children and adolescents kind of move through this process. But I'm going to go through and we're going to talk about these from the perspective of children and youth, and then we're going to do it for caregivers as well. So what it might look like. And again, just know that this is just a model. This is not an end-all be-all. There is a book that is a recommendation that I have for all of you that was really pivotal in my understanding clinically of how children understand kind of grief, death, and loss and things like that. And it's a book by Maria Tarazzi that's talking to children about death and dying. I think if I remember correctly, I'm looking to see if I have it in my bookcase. Anyway, I'll pull it up on the last slide, but it really kind of gives you this more fluid type of a process where, you know, children and adolescents don't move through, you know, complete one step and then move through the next stage, and then complete that stage and then move through the next stage, which is really how Kubler-Ross's research really describes the process. Is it's a very linear. You start with denial, and then once you complete denial, and you move into anger, and then once you complete anger, then you move into bargaining. Like, you can't jump from denial to acceptance. It doesn't work that way. So again, I want this just to kind of be a model for you, and then we're going to go through and we're going to look at how this affects caregivers who might be moving through these you know, different stages, and then what it might look like in children and how caregivers can help. And that'll kind of be the bulk of this next section of the webinar. So again, a short way that I typically remember these stages is by the acronym DABDA, D-A-B-D-A, so denial, anger, bargaining, depression, and then acceptance. All right. So let's look at the stages and what it might look like for caregivers. So these are adults. These are you, foster parents, adoptive parents. I'm talking to you in this section. So with regards to denial and shock, what that might be, what that might mean. Denial and shock actually helps us cope by numbing emotions that are too painful to experience at the time. So if you're a foster parent, and when we're talking about grieving and losses, the one that typically comes to mind is when kids are moved from your home for whatever reason. Maybe it's reunification, maybe it's because of some behaviors that have become a safety concern. Maybe you were not able to continue to be a foster parent for whatever reason and the children had to be moved, whatever it might be. That first stage, again, denial shock, it's a way that helps us cope with emotions that are too painful to experience at the time. So what that might look like, we start thinking to ourselves and saying things like, maybe the child will be returned to this home, to my home. This move is only going to be temporary. Saying things like, this child cannot be leaving this quickly. Who can I talk to about getting this changed? And what partners can do. And when I'm talking about partners, I'm talking about what can caseworkers, what can home supervisors, what can, the people that are on your team, who are those people? Is it the guardian ad litems? I don't know in your state if you have CASA workers. Is it the therapist? Partners, I'm talking about everybody else on the team. What can they do to help you in this stage? Things like including caregivers in all placement decisions and regarding any potential changes as early as possible. So then we move into the anger and the guilt stage. So what does that mean? So accepting the fact of anger as a legitimate feeling. This misplaced anger often falls on the agency and or individual workers and can cause hurt feelings and misunderstandings. So what might it look like? Feeling that you should have done something differently, not sharing in the joy that others might be feeling about this particular change. Could include sabotaging the change that is occurring. And then what can partners do to support caregivers in this stage? Acknowledge feelings, continue supporting the caregiver, not personalize the anger that might be directed at them, and reassure caregivers. And I think kind of that contact, that kind of constant contact is always helpful as well. Then we move into bargaining. So what does bargaining mean? So making deals to alter the plan so that this particular change doesn't occur. So what that might look like. We've all been in this phase. We've all been in the bargaining phase. So might be repeat calls to others expressing your love for the child, how committed you are to the child. Maybe things like offering to drive unreasonable distances every day in order to keep the child in your home. Making deals with maybe other caregivers to split parenting time. Maybe even offering to take on more children in your home if this particular child can stay. So again, bargaining, we're trying to figure out what we can do to keep this change from happening. And then what can partners do in this stage? Again, reassure caregivers of their value, that they're important, that they're needed, that they are a part of the team, and keeping caregivers in the communication loop as early and often as possible. All right, and the next stage turns into despair and depression. So what does this stage mean? Sadness over no longer being able to see the child, hold the child, even know how they are doing. Again, if they go home or if they go with kin and there is not an opportunity to be able to keep in contact, which is unfortunate, then you might not ever know how they're doing unless you, heaven forbid, get that phone call where they've come back into care. You might feel tricked, kind of deceived by other partners and left out of the loop. So what might this look like? The caregiver might stop communicating with others because it's too hard to discuss. Wondering how could the courts, the partners do this to this child? And then having thoughts that something bad will happen to the child and you are powerless to be able to do anything to stop it. And I'm sure there are some of you that have definitely had this experience when you've had children who've left your home. Kind of that uncertainty, that helplessness type of feeling, it's can be very debilitating and really can make you question whether or not you want to continue to do foster care or adoption. And what can partners do? Make phone calls and send notes acknowledging the loss and sadness. Invite caregivers to events and meetings. Give updates on the child's progress. Listen and be genuine. Be genuine and be authentic. And I think acknowledge that this is very hard. We are asking caregivers, I think, I don't even know what the right word is. I mean, we're asking you to open your hearts and open your homes, and we're asking you to provide this amazing high quality care to children, and at great risk a lot of times. I mean, at great risk, and it can be very painful and not make a lot of sense sometimes. Okay, and the final stage for caregivers is acceptance. And so what acceptance means is coming to terms with the changes that have occurred and accepting that your love and parenting mattered in the life of that child. And what might it look like? So maybe caregivers are now to the point where they are asking about another placement. Maybe, you know, you took some time off after the last one, which I really encourage for a lot of you, is that if there's a reunification or if a child has to be removed for whatever reason, take a break. Take a break, you know, take care of yourself. If you're with a partner, you know, focus on that relationship for a little bit, maybe your other children in the home, kind of regroup. Don't rush in. There's this huge, I think a lot of times for a lot of families, there's this, you know, feeling that when something hurts, that if I just replace it, you know, if this kid leaves and I'm devastated, if I just get another kid, then that's going to take the pain away and that's going to take the hurt away. And it doesn't. It doesn't. It's just like, you know, I'm not minimizing it by comparing it to pets, but, you know, if you have a dog or a cat and your pet dies, then you run out and get another pet to try to lessen the loss and the pain of the one that, you know, maybe you just lost. It doesn't. You know, it might seem like it does for a short period of time, but that wave of pain and hurt is going to come back, and it's going to come back strong. It's never going to just kind of go away. But if you've taken some time and you've kind of moved through the process, whatever that looks like for you, you might get to the point where you said, you know what, we're ready for another placement. And then the caregiver is continuing their partnerships with the others involved. And what can partners do at this stage? Include caregivers in ongoing efforts, recognize and acknowledge their expertise, and seek their input. We all want to feel valued and appreciated. All of us do. There's no exceptions to that. And especially for our caregivers who I think are, you know, doing and going above and beyond, and putting, you know, again, they're putting their hearts out on their sleeves at you know, a great risk, that it's our job kind of as the rest of the community and as the partners to support those parents when things are going well and when things are very painful. We have to be there through thick and thin. It's not, you know, just dependent on when things are going really well. All right, the next set of slides is looking at what are some of the feelings and behaviors associated with children or youth with regards to grief and loss and kind of how to help. So there's quite a few, so I'm going to kind of go through these. The first thing that I want to point out is that the stages of grief are really very disorganized in children. Children are less verbal and typically communicate through their behaviors. So I am a therapist of the belief that there is a function and a purpose to every behavior. Even as adults, there's a function and a purpose to all of our behaviors. And all a behavior is an external expression of some internal emotion, maybe some internal dysregulation, depending on what's going on with you or your child. And for a lot of our kids, the only way they have to communicate those big, powerful feelings is through their behaviors. So children do not understand that their behavior is an expression of grief, and they're likely to say things like the 3-word, "I don't know," when asked why they're acting out. So it's also important to remember that our kids typically can act out when they are depressed. Depression does not look the same in children and adolescents as it does in adults. Children may not have acting out behaviors when they are in shock, and the acting out behaviors may come later in the placement. And there's really no predictable timeline for a child to go through the stages of grief. And also it's important to remember that children may revisit different stages at different times in a very disorganized pattern. So again, we're going to go through the stages. So denial. So from a kid's perspective, things like my family will be here soon to pick me up. This might look like disbelief, defensiveness, numbness, feeling of kind of unreality, shock, and panic. So some of the behaviors that you might see in the denial stage, you might have kids that are very cooperative and compliant, those people pleasers, those kids that kind of fly under the radar, can also be in the denial stage. You might have kids that are very quiet, withdrawn, chronic fatigue, sleep changes, kind of that automatic behavior of just kind of soldiering on. Just kind of keep going, keep going, keep going, keep going, keep going. Asking when they're going home repeatedly, fantasizing about a rescue. The parents are going to come in on the big white horse and, they're going to take them back to the castle. A refusal to unpack or settle in. You might see lying, maybe kind of to themselves and to other people. And you might see regressive type behaviors. Could be bedwetting, thumb sucking, maybe baby talk. During the first phase of placement, children typically behave well because they're in shock, or what we call the honeymoon stage. They're still trying to navigate those waters and trying to figure out kind of what game do I need to play in this house, what's expected of me, what's going to keep me out of trouble. Kind of being a puppet and just kind of playing a part is how I describe it. How to help a child that might be in denial. So acknowledge the loss and let them know that it's okay to talk about it when they're ready. Make yourself available. Answer their questions honestly. And if you don't know, say, I don't know. Reinforce the security and safety of the new environment. Show genuine empathy to the child's loss of the parent. Provide consistent nurturing in this new family setting. All right, so now moving into the anger stage. An example might be, I hate social workers. They don't understand anything about my family. This may manifest itself in frustration, worry, being annoyed, kind of a sense of apathy, not really caring one way or the other, or hypersensitivity, easily agitated, irritable, resentful. You may have a child or a teen who isolates, one who's confused. So some of the behaviors that you might see in this stage, increase in defiance, disrespect, maybe fighting, hyperactivity, poor school performance, lack of concentration. You might still see regressive behaviors. When we're stressed out, our brain goes back to what we know. So when we are stressed, when we are fearful, real or perceived fear, threat, or danger, our brain goes back to what it used to do and what it used to know. And so that's when you typically will see an insurgence of regressive behaviors. They might try to create the chaos of their previous life in your home because that's what's normal to them. That's what's comforting to them. You might see an increase in tantrums or behaviors that are designed to kind of elicit a sense of shock. Kind of to, that kind of beyond the wow factor, but when kids are really trying to get a rise out of you. So how you can help a child who might be in this stage: acknowledge the anger, call it for what it is, validate the child's right to be angry. We have a right to be angry sometimes. Sometimes we just need help figuring out what to do with that anger, how to channel it. And a lot of our kids don't know what to do with that. So help them channel that. Help them be in control of something positive. Provide appropriate outlets to redirect some of these behaviors. Look for and praise positive behaviors. Look for, acknowledge, and praise the behavior that you want to see more of. We oftentimes give so much more attention to the behavior that we don't want to see that it then reinforces that behavior. And remember, typically under all anger is a sense of fear. And there's really only two core emotions, fear and love. And anger is a subsidiary of fear. So again, if you can step back and look at, my kid is very scared, my kid is really fearful, that might help you be able to then kind of regulate yourself so that you can then step in and try to connect with your child, understanding that it's coming from a place of fear, that they are scared, they are worried, they feel out of control, they feel like everybody's making all the decisions for them. And then use that and tap into your own ability to be empathic and genuine so that you can then connect on a relationship level. So then in bargaining, if I'm allowed to go home, I'll be the best kid, I'll clean the house, I'll get good grades. You know, we've all heard things like that. So some of the feelings in the bargaining stage is kind of finding ways to assert control, the desire for more control. Sometimes there's this unrealistic expectations. They're afraid of having any hope. I want to have hope, but I'm not sure. I don't want to get my, what if it doesn't happen? Then I'm going to be let down again. Guilt, blaming, and increase in anxiety. So some of the behaviors you might see in the bargaining stage are things like overcompliance. So that kind of perfect child. If I'm good and if I don't cause any problems, then maybe I can go home, or I can see my mom, or I can see my siblings. So again, you might kind of see that resurgence, maybe if it was there before, maybe during the honeymoon phase, or kind of that consistent kind of people pleaser type of mentality. Maybe some irrational thinking, wishful thinking, fantasizing, some manipulation, maybe some obsessive behaviors. Again, kind of when we have intrusive thoughts, when we kind of have these compulsive thoughts, sometimes we have to do some sort of an action to try to calm those thoughts down. So you might see kids who develop some of those traits. Unexplained behaviors based on the child's distorted thought processes. So how you can help a child in this phase: acknowledge their feelings of powerlessness, or reassure the child that they'll be safe. Reinforce the idea that adult problems are not the child's fault and that they're not responsible for fixing the problem. Try to identify the bargains the child is making. You know, if I fail at school, they'll send me back to my birth family, and redirect, kind of, you know, kind of confront those distortions head on. Empathize with the child's grief about things not going the way that they want them to go, kind of that loss of control, and help them in your home and everyday decisions have more control. Find ways that your kids can assert more control. Provide daily opportunities for the child to have some control. You know, again, decisions about clothes, you know, food, you know, do you want the blue coat? Do you want the red coat? Do you want milk? Do you want juice? You know, do you want to read a story tonight, or would you rather watch, you know, another 15 minutes of TV? Things that you are okay with, you set them up, and then have the child kind of make the decision. Every little opportunity to be able to have some control is going to alleviate that overall out of control feeling for them. So some of the feelings then in the depression stage, thinking about who's going to take care of me, you know, I want to feel loved, I want to feel wanted. This may manifest as sadness, you know, kind of feeling empty, numb. You may have kids who tend to kind of check out or dissociate. It's a very adaptable coping mechanism, especially at this stage. Sense of hopelessness, feeling lonely, isolated, a loss of interest, low self-esteem, lack of regard for others, loss of faith. Some behaviors during this stage, kind of listlessness, fatigue, maybe apathy a little bit, flat affect, not much expression on their face, kind of withdrawing, wanting to be alone more often, not wanting to engage with others. Somatic complaints, so an increase in complaints about stomach aches, headaches, feeling nauseous, changes in appetite, sleeping changes, change in grades, how they're functioning in school. You might see an increase, or it might come up for the first time where your kids or your youth are talking about thoughts about wanting to die, maybe even attempting to hurt themselves. An increase in self-injurious behaviors, maybe with substances, tobacco, marijuana, other drugs and alcohol, cutting behavior, sexually acting out. So things to definitely pay attention to. If you're concerned, if your kid is, posting things on Facebook or sending text messages or emails that seem concerning to you about not wanting to live, or I just want to go to sleep and never wake up, you need to take them in and have them evaluated. We take all of those things very seriously. And since that's what I do for a living, for part of my time, I really encourage parents, you err on the side of caution. Even if your kid is cutting and saying they're not suicidal, you still need to get them checked out. The fear with cutting behaviors is that the kids will cut too deep, they'll cut in the wrong direction, they'll cut in the wrong place, and they may not be intentionally trying to kill themselves. But again, we always have to err on the side of caution. We have too many children and adolescents in this country who are attempting and completing suicide. So please always err on the side of caution and get them checked out. So how you can help a child who might be in the depressed stage: express genuine unwillingness to give up on them, kind of, emphasize your commitment. Continue inviting the child to engage with the family in, different positive activities. Validate their feelings, acknowledge their feelings, offer support and encouragement. Try not to take this personally. It usually has nothing to do with you, but it's usually just about something else that's going on. Seek professional help if necessary, to determine if this is a part of the grief process, or is this like an indication of another type of disorder, maybe a mental health issue that needs to be addressed. Feelings in the acceptance stage. So this might look like, I'm in this home, it's not my home, but I'm safe. I might never meet or go back to my birth family, but I have a forever family. So what this might look like, kind of feelings in this stage, a sense of belonging, have become resolved to the current situation, able to cope with the pain of loss, hopeful, sense of hopefulness for the future, returning sense of strength and motivation. You see a shift in their self-worth and their self-esteem, and kind of an emerging sense of peace about the past for some folks. Behaviors in the acceptance stage, kind of a re-engagement in positive activities, maybe activities that they were doing before that kind of got put on the back burner. You see healthy sleeping and eating routines, responsiveness to the family system, and leadership of parents, kind of the structure, the rules of the home, etc. Interest in creating and maintaining positive relationships, maybe a sense of playfulness, making some efforts to improve. Maybe that's getting back on track in school, maybe with sports, some of their extracurricular activities, seeking comfort in new attachment figures, And I know that that last one is cut off a little bit, but increase in the use of healthy coping skills. And how can you support a child's acceptance? It's validate their journey and validate and honor their story. I'm a big proponent of using life books to really kind of create a platform, a tool, if you will, to really tell the story of the child or the adolescent, honor those people in their life, those achievements, those accomplishments. Um, you know, just again, what's shareable is bearable, and we can talk about their life, all pieces of their life. Really leads to kind of that coming together of one's self-worth and value, and kind of answering those questions of who I am and how do I fit into the world. Give them permission and opportunities to enjoy themselves, continue to provide the parental guidance and structure that they need, build upon their accomplishments to encourage confidence in meeting new challenges. And I know it says handout 3 down here, but there's no handout, so my apologies for that. So what happens if a child is unable to grieve? So you might develop some extreme anger, control problems. When somebody feels so out of control, you're going to see an exacerbation of behaviors coming out as a way to try to assert more control. It's going to inhibit their ability to trust. And for a lot of our kids, their early attachment cycle was already disrupted, and so trust is already an issue. We don't really want to contribute to that. We really want to help resolve that. So again, another reason why it's so important for us to first be comfortable with this whole thing of grief and loss for ourselves and for our children and for our families. They might lack the ability to give and receive affection. So some of the obstacles to facilitating the grief process is being told how you should or shouldn't feel. So a good example of this is, you guys ever been in a situation where you've been sad about something or you've lost something and you're kind of in the grief process, and you know, somebody tries to come up to you and tell you, oh, I've been through that exact same thing and this is what worked for me, so you should try this, or you know, thinking that our experience is the same thing as theirs when it's not, because we're very different and they're each unique even of ourselves. I don't want somebody to tell me how I should feel about something or how I should react about something. That is my own. That is my truth. That is my experience. And so it really just kind of puts me on edge when somebody tries to tell me, you know, how I should feel about something. That's your experience. That's not mine. So again, I want to be validated, and I just kind of want to be heard. I don't want somebody to try to fix it and to tell me this is what you should do. If you are a person who's going to take things personal, again, most of this is not related to you at all, but because the kids are in your home, you're typically the person that they feel safe with. You're typically going to get the brunt of their behaviors. And that's because they feel comfortable enough kind of showing you their true colors. That's an opportunity. That is an opportunity for you to use your relationship in order to come alongside them and help them and support them. Another obstacle could be telling the child, you have to be strong and just get on with life or just get over it. That's not going to be helpful at all. Setting particular time frames, you've got 2 weeks to deal with this, and then you've got to like just get over it. That's not going to be helpful either. Another obstacle can be the repetitive losses, one after the other after the other. There's not really a period of time to be able to kind of regroup and kind of move ahead, because then you just got smacked down again by something else. And for a lot of our children and adolescents kind of in the system, they are compounded with repetitive losses over and over and over. And sometimes for us as caregivers, we are also experiencing kind of those repetitive losses over and over and over. So a couple things. So a few reminders. really a caregiver's mindset must be unconditional and not reactive. And I know that that can be very difficult, especially if you're having a hard time yourself, for whatever reason, just not in a good place, not regulated, you're stressed out a lot, whatever it might be. It's going to be very difficult for you to be kind of that responsive, attentive, regulated caregiver that somebody else is going to need. And that children may revisit stages of grief when triggered by things like birthdays, anniversaries, holidays, court dates, visits, season changes, etc. This also goes for us as adults. We are going to revisit stages of grief and loss when we are triggered by anniversaries, certain dates, times of years, holidays, birthdays. So it applies for us as well. I think we all, and this is children need permission, but I think we all need permission to remember and talk about these losses, whether it's a person, whether it's an event, whether it's a pet, whether it's a job, whether it's a certain role that we had. We all need permission by those around us to be able to talk about and to kind of revisit and just share sometimes. And each child's ability to be resilient is unique to the child, and each child grieves differently. And again, I'm going to say that goes through us as adults as well. Each of us has the ability to be resilient, and that ability to be resilient is unique to each one of us, and we grieve individually and very differently. The next couple slides are just some suggestions of, helpful comments versus things that might not be so helpful when we're dealing with grief and loss. Some of the unhelpful comments, I know exactly how you're feeling. I can imagine how you're feeling. You should be over it by now. You had so much time together. You're very lucky. Maybe things like, if it's a partner that you lost, you're young, you'll meet somebody else. And then some of the more helpful comments, I'm sorry that you're going through this painful process. Must be hard to accept that this has happened. Be specific. If people say, I'm always here for you, call me if you need anything. The suggestion is to be specific. I can bring dinner for you. I can drive the kids to school on this day, this day, this day. Kind of asking questions. It's not easy for you, is it? What about your relationship will you miss the most? Seems like they meant a lot to you. So again, just a little guide that might help you. Some things, suggestions of things to do versus some things not to do. So some things to do, know your own beliefs. Begin where the other person is. It says child, but I'm saying begin where the other person is. Be there, be honest. Allow and encourage the expression of feelings. Encourage remembering, celebrating, commemorating. It's okay to say when you don't have an answer for something. Some suggestions of what not to do is don't praise stoicism. Don't tell fairy tales and half-truths. We all want to try to protect other people that we care about. But sometimes we just have to be careful with that. Don't close the door to them asking questions. Don't be judgmental of feelings and behaviors. So it's not surprising, though, that this is kind of a unilateral process where we're all affected by grief and loss. So it's not shocking that your grief is going to be triggered too. And it could bring up things like if you had infertility issues prior. When a foster child is reunited with their birth family, that's going to bring up some grief and loss for you. Heartache for the grieving child, past loss of your own loved ones, maybe bring up divorce or failed relationship issues, your own past trauma history, which can be exacerbated by secondary trauma or compassion fatigue, or you might be burned out. You might be burned out as a caregiver and might need to take a break, or some issues or concerns with your family of origin. So especially for my foster and adoptive parents out there, be clear in your intentions about fostering and adoption and supporting permanency for the child, whatever that might look like. Grief will occur, and you may experience the stages of grief when the placement ends or even after adoption. It is important to connect and bond, create attachment through relationship with the child while preparing for the reality that the child may move on. Do not talk in front of the child about your concerns about reunification, and that you can be a positive role model for coping with loss with your child or your adolescent. You really can model some very healthy and appropriate behaviors that maybe our kids have never been exposed to before. So you're in a very unique situation in order to offer that gift to them. You know, how to take care of yourself when you're supporting somebody else who might be grieving. Don't take the grief personally, that we've talked about, which is really hard to do in the moment. Be willing to reframe the child's behaviors in terms of dealing with his or her loss. Develop your own support system of trusted people to help separate your own feelings from the child's feelings. Address your own grief triggers with professional support if needed. And with that, I kind of want to take a minute and I just kind of want to talk about that for caregivers. You know, our system is asking, again, I mentioned this before, a lot from you all. You know, we're asking you to take a child into your home who's been abused, neglected, emotionally deprived, or who has at the minimum suffered significant separations from a multitude of people. We are asking you to invest emotionally and physically in that child, to nurture them, to cope with and help them through their behaviors and emotional difficulties. We are asking you to love them as if they were your own child. Sometimes we're asking you to use your own personal funds when the needs of the child surpasses the resources the child is provided for their care. We're asking you to keep professionals informed of all developments with the child, and we're asking you a lot of times to co-parent. But some of the realities that are out there with regards to caregiver grief is that grief is normal for all of you. I think it's important to recognize that, you know, foster parents and even our adoptive parents are grieving. There's kind of a grief process that happens for adoptive parents shortly after the adoption happens. There's kind of this dichotomy of emotions that happens because it's very exciting. You've waited a long time for this to happen. You know, people kind of drop off the face of the earth. They stop coming around all the time, and sometimes we want it like that for a while. But then there's kind of this little phenomenon that happens. It's like almost like a post-adoption depression that can happen for some of our adoptive parents. And that can tap into, again, some of our early experiences and stories. It can tap into, you know, kind of the loss of not having a biological child. It can tap into grieving the loss of, you know, who you envisioned your child was going to be, what type of child, grieving the loss of maybe the experiences that you didn't get to have with them when they were younger if you're adopting an older child. So I think it's important that we pay attention to, you know, again, not just this exciting, joyous experience that's happening, but there's also a loss that takes place at the same time we have an adoption. And then moving into the grief process and kind of what previous experiences is this bringing up for us that we still have to work on. So I just want to normalize that for a lot of you, if you can relate or if you've had that experience. Caregiver grief is normal. We're foster parents, kinship parents, adoptive parents are grieving. And sometimes the grief begins well before any apparent reason for the grief. Caregiver grief is not lessened because we know that there is a possibility or even certainty that the child may be removed from our home. Caregivers may be grieving because of the knowledge where the child has been placed. When a foster child in particular is returned home in which they have previously experienced abuse. Our foster parents or even our kinship parents do not have the insurance a lot of times that child is in a better place. Children are not replaceable, and sometimes there just really isn't any closure for grief. And I just want to share with you a couple of comments from parents. These are kind of statements from caregivers to kind of professionals in the team when talking about grief and loss. And while I'm talking about that, I'm going to put up this page that's got some additional kind of resources and reference on. But a lot of parents will say, the grief is not any easier because you told me that it was coming. Receiving training in grief and loss is not the same as receiving high quality support, which I absolutely agree with that. Our support needs to be different than just what we talk about in training. It needs to be in real time. It needs to be continuous. It needs to be ongoing. And other parents have said, because the child was, quote, difficult to parent or had difficult behaviors, it doesn't mean that the grief is lessened any. It doesn't lessen the grief at all. Replacing one child with another does not speed up the grief process. Another parent said, my grief is real. It can't be adjusted because it's inconvenient for other people. And when we talk about partnership, it means that we share both highs and lows, sometimes good and bad. Think about from the standpoint of grief and loss, what messages would you send to professionals, to those other partners that are working with you? Some things that I've heard from other caregivers, kind of that continuous acknowledgement that they're valued and they're appreciated. So things like thank you notes or, just periodic check-in text messages or phone calls is really helpful. That some caregivers might need a break and might need a long break in between placements in order to kind of regroup and reevaluate. So don't rush them into taking another placement. Being open and honest with caregivers. Kind of understanding, another parent was saying, kind of understanding that it should be looked at as kind of a way of living rather than a process, because it never really goes away. We learn to live with it. We continue to experience the grief of that loss for an entire lifetime. And having these things called listening sessions has come up, and it's come up actually out here in Colorado too. Opportunities where parents can kind of get together and share in a very non-judgmental, not feel like there'll be any retaliation for just kind of talking about how hard it can be sometimes, from the standpoint of a foster kinship and adoptive parent. And acknowledging that there's kind of no finish line when it comes to grief. This isn't a race. That we're going to feel anger. Sometimes you just kind of have to go with the rhythm of whatever your grief is, that you can't really drive or dictate it. And again, one of the other things I just kind of want to talk about before we're almost finished is finding ways to commemorate losses. And so my question then to each of you is, how do you and how have you commemorated losses that have happened in your life? You know, I'm going to share a couple. You know, as a caregiver, if you've had children that have come in and out of your home, you know, having those losses, one suggestion might be creating a stone garden with the children's names, creating memory books or boxes, writing letters and storing them in the memory books or boxes. Another suggestion is saving a favorite piece of clothing or an outfit in a keepsake box. Create a family tree and add their name. Another idea is release balloons with messages up in the sky. Maybe have a special wall with snapshots of all the children and adolescents and a bulletin board with memorabilia. Remembering their favorite foods and having those on special days, maybe making a scrapbook or a life book, and you keep a copy and you give one to the child or to the teen. So, you know, thinking about how do you guys commemorate? What has that looked like in the past? What would you like to start doing? You know, what ways can we highlight, you know, the gifts that, you know, these kids have given to us, or that these adolescents have shared with us? So think about that. Maybe try something if you haven't done something in the past. So on here, there are some books that I would recommend if you're interested in this topic further. Again, the one that I was talking about earlier by Maria Trazi is Talking with Children About Loss. All of these books are fantastic. There are a couple of webinars. I mentioned the Loss and Grief in Foster Care by Dr. John DeGarmo that's on YouTube. That video is about 20 minutes long. There's also an hour-long video through the QPI, which is the Quality Parenting Initiative in Nevada, called Understanding and Responding to Caregiver Grief and Loss, and I've put the link up on here as well. In addition to a couple of websites, and then just some additional information for you. And last but not least, I would like to just read a quote kind of in closing for you all. The risk of love is loss, and the price of loss is grief. But the pain of grief is only a shadow when compared with the pain of never risking love. So with that, I just want to thank you all for your time. I want to thank you for all that you do for all of our children. And I just want to take a minute and honor you and let you know that I am here as a resource for you. If there's anything that you should need, any additional information, again, I will email this PowerPoint to the staff at the Central Missouri Foster Care and Adoption Association. If any of you are interested in having that sent to you, just contact them, or you can contact me. My email is Denise Rice, one word, DENISE RICE @hotmail.com, and I am happy to send that out to you. I hope that you walked away with some tools, a couple of aha moments, and that you'll kind of continue this process of kind of learning about yourself, and so that we can be those caregivers that our children and our youth are so dependent on. So guys, thank you again. I appreciate it. Maybe we'll cross paths again in the future. I wish you all the best. Take care.